Hi, everybody. I'm Dan Kleidman, editor-in-chief of Yahoo News, and welcome to this special live interview with Dr. Anthony Fauci.
And I'm Michael Isikoff, Chief Investigative Correspondent for Yahoo News. Dr. Fauci, thanks for joining us. Let's start off with where we are right now. You've been warning for some time that there may be a second wave of COVID infections this winter. As many as 40 states have seen increases in cases over the past week. Yesterday, we saw nearly 60,000 cases reported nationally. The Washington Post ran a headline yesterday: next big U.S. coronavirus wave may have begun. Has it? And if so, how long is it going to last? And how bad do you worry it's going to get?
Well, Michael, I think we're not in a good place. And I keep referring, when people say that, we talk about a second wave. We have never really gotten out of the first wave. If you look at the baseline number of daily infections that we have had over the last several weeks has been around 40,000 per day. It's now gone up to about 50,000 per day. So right away, we have a very unfortunate baseline from which we need to deal. And then, as I would have hoped, as I was saying over the previous weeks to months, as you enter the cooler months of the fall and the colder months of the winter, you would like to start that with a very low baseline, well below 10,000 per day. So now we're going into that at 50,000 per day. And as you mentioned correctly, if you look across the country, the number of states, more than 30, are now showing what we call increase in test positivity, which is a pretty good predictor that you're going to get a surge of cases, which then ultimately will lead to more hospitalizations. So we're going into a precarious seasonal situation with people spending more time indoors than outdoors, which is not good at all for a respiratory-borne infection. And then you have these uptick in cases superimposed upon a high baseline. So that's not where I would have wanted us to be. So we've really got to double down. We don't want to lock down. Whenever I say this, people say he wants to shut down the country. Absolutely not. That's off the table. We're not talking about that. We're talking about intensifying some public health measures that are really simple and easy to understand, and to do it uniformly as a country instead of in a haphazard way.
Dr. Fauci, you said that you thought we needed to be at 10,000 cases a day going into the winter months. Yesterday, we were close to 60,000. Right. So how do you explain that we are going so alarmingly in the wrong direction right now?
There are several things that have gone on. I think if you look across the country at representative clips about what's going on, we need to have 5 approaches: uniform wearing of masks, keeping physical distance at least 6 feet where possible, avoiding congregate settings and crowds, doing things outdoor much more preferentially than indoor, and washing hands frequently. When you see what's going on right now, you see pictures of people congregating in places, in bars. People go to different functions. And even now we're seeing, because there's so much community spread, that even in simple family settings where you have 4, 6, or 8 people gathering at a dinner, because of the fact that there's so much community spread, people don't appreciate that they may be infected and have no symptoms and then spread it within a family. We've got to get down to the fundamental public health measures. The reason we're going up is that we haven't done that consistently. Take a look at what's gone on over the previous several months when states try to reopen the economy, the open up America again. If it had been done in a uniform way that was prudent and careful, we would not have seen those surges. So what we see is that some cases do it reasonably well, some states do it reasonably well, and others jump over the guideposts and the benchmarks of things that need to be done carefully. And then even in some situations in which the states, i.e. the governors and the mayors and others, put out the guidelines correctly, you would see that people in the states would disregard them. There's this issue with masks, that it's become a political issue, whether or not you wear a mask or not. That should not be. This is a public health issue. And the enemy is the virus. that's we're trying to suppress, not each other in how we feel about whether or not we should wear a mask or whether or not we should congregate in a big setting where the people are crowded close together. We've all got to pull together in a public health endeavor, not in something that is essentially arguing with each other.
Well, Dr. Fauci, I just want to pick up on your comment about you're not talking about lockdowns, yet you were critical of governors that have opened up their economies in the last week. So I see a tension there. And I just want to add one more point. Dr. David Nabarro of the World Health Organization, special envoy on COVID this week, said lockdowns just have one consequence that you must never, ever belittle, and that is making poor people an awful lot poorer.
Right.
Is he right?
So yeah, no, but Michael, I'm glad you said that, because what you've done is, I think by you said it, innocently and inadvertently, you've created the scene where there's confusion, because I'm really glad you did it, because you've essentially pinpointed what people think is that there's a lockdown and then there's let it rip, let everything fly, do whatever you want to do. Both of those are not correct. What we're talking about is that you can effectively, carefully, and prudently open up the economy without locking down, because you can get employment going, you can get businesses going, and still carefully do things like the wearing of masks, the avoiding of crowded situations. People tend to think, understandably but incorrectly, that either you're essentially locked down without doing anything or you're doing everything. I discussed this very clearly months and months ago when we used to have the daily White House press conferences. I would say be careful of the all or nothing mentality, where people feel either I can't do anything, we stay at home, we lock down, the economy crashes, or we do everything and don't pay attention to public health measures. We've got to get into the mentality that we're going to use careful, prudent public health measures as the mechanism, the gateway, or the roadway to opening the economy, not as the obstacle to opening up the economy, but the way that we will open the economy. So we've got to get away from this lockdown, because every time I talk about prudent public health measures, someone says he's talking about locking down the country. I'm not. Let's say it clear. Get that off the table. I'm not talking about that.
So Dr. Fauci, you talked about one of the problems with the trajectory of this virus is that Americans are not sufficiently following the guidance of public health professionals, governors and states. Let's talk a little bit about modeling behavior, because that is really important, particularly from our top leaders. So I want to ask you about President Trump. As you watch the footage of Trump's campaign rallies, people not wearing masks, a lot of people crowded in together, no social distancing. What goes through your mind?
I mean, that's a risky situation. I mean, again, people ask me that question, and it often gets that pitting me against the president. Put that aside for a moment and just talk generically. It doesn't matter who you are or where you are. When you have congregate settings where people are crowded together and virtually no one is wearing a mask, that's a perfect setup to have an outbreak of acquisition and transmissibility. It's just a public health and scientific fact. We know that. We see that happening over and over again. And you can't run away from the facts. So I'm not trying to point a finger at any particular individual or group. I'm just saying in general, generically, when you do that, you are going to be in a risky situation.
Okay, I don't want you to point fingers either, but I do want to ask you, I assume you prefer an approach more like Joe Biden's, often wearing a mask when he speaks, talking only in front of a smattering of highly socially distanced people.
Daniel, this is a trap, because you're putting it into a political context. I prefer one versus the other. I'm not going there. I'm talking generically. You should do things according to good public health guidelines. That means sufficient spacing, uniform wearing of mask, avoiding crowding situation. It doesn't matter where you are, who you are, or what your political party is. So I'm not going for one versus the other.
Fair enough.
Dr. Fauci, is the White House COVID task force still meeting? And if so, how often? And when's the last time you attended a meeting?
Well, Michael, it used to be when in the height of things, when we were concentrating very heavily on the issues of public health, we were meeting, sometimes 7 days a week. Then it went down to 5. We're down to about, I would say, a consistent 1 day a week. But in addition to that, we do have what's called a governor's meeting, where certain members of the task force are with the vice president. We used to do it exclusively in person, but now we're doing it more virtually, where we interact with the governors and answer their questions. And then several of the doctors on the task force, led by Dr. Birx, who is the coordinator, myself, Steve Hahn, the commissioner of FDA, Bob Redfield, Seema Verna from CMS, we meet together at least once a week, either by phone or in person. Over the last couple of weeks, because of the degree of infection in the environment of the White House, we've done that mostly virtually. So the short answer to your question is official task force meetings once a week, plus governor meetings and other phone calls.
Are you still invited?
Yeah, absolutely.
To the White House.
Yeah, absolutely.
And when's the last time you briefed the president?
Well, I don't know what you mean by brief. I spoke to the president last week. I don't want to be talking about the kinds of things you talk to the president of the United States. That's not appropriate. But I did speak to him last week.
Dr. Fauci, there were reports that the White House, including Dr. Scott Atlas, one of the president's advisors on the coronavirus task force, may now be embracing herd immunity as a policy and may favor the so-called Great Barrington Declaration, under which only people at high risk of dying would be protected from the virus. Do you think herd immunity is a viable strategy for the U.S. to adopt?
Yeah, Dan, thank you for giving me the opportunity. I'll tell you exactly how I feel about that. That, again, is another trap, because when you talk about the Great Barrington Declaration, what they say in there and then what is implied are two different things. They say, A, we need to protect the vulnerable. I totally agree with that. No problem. That's apple pie and motherhood. The other thing is that you don't want to lock down or close down the country. I certainly agree with that. I just said that. But in there is the implication that if you just let anybody get and everybody get infected, don't wear masks, let children get infected, let everybody get infected, and just protect the vulnerable, like being really careful in nursing homes and places like that. That doesn't work, because in our community, there's maybe a third of the population, depending upon how you figure it, that are vulnerable and would be prone to getting serious complications from COVID-19 disease. It is impossible, and we've never protected those people in the community. They're not in nursing homes where you can do things in nursing homes. You have the elderly, obese people, people with underlying conditions like heart disease, diabetes, and other conditions. If you let infections rip, as it were, and say, let everybody get infected that's going to be able to be getting infected, and then we'll have herd immunity, quite frankly, that is nonsense. And anybody who knows anything about epidemiology will tell you that that is nonsense and very dangerous. Because what will happen is that if you do that, by the time you get to herd immunity, you will have killed a lot of people that would have been avoidable. So, there is a certain core group of people that are saying that. But talk at the standard people throughout the country who understand infectious diseases and understand epidemiology, with the exception of the few that who we're talking about, they would all vehemently disagree with this idea of just letting everybody getting infected and don't worry about it.
Well, but isn't that the position
how concerned are you,
of Dr. Isn't that the position of Dr. Atlas at the White House?
That the White House maybe open to herd immunity, and have you made your position known on that?
Well,
The
I
White
think
House.
my position is known. Dr. Deborah Birx's position is known, and Dr. Bob Redfield. So you have me as the director of the National Institute of Allergy and Infectious Diseases, Debbie Birx as the coordinator and a very experienced infectious disease person, the coordinator of the task force, and you have Bob Redfield, who's the director of the CDC. All three of us very clearly are against that.
You were a bit in the news last weekend because the Trump campaign used a clip of you in one of their campaign commercials saying, "I can't imagine that anybody could be doing more." Two questions about that. Number one, you publicly objected to the ad, but have you directly reached out to the Trump campaign asking them to remove you from it? And number two, you've said that you were taken out of context in that statement. Exactly how so were you taken out of context?
Well, Michael, let me explain to you why I was concerned about that. As I've said in a statement that I made, an official statement, that I have been in the public health arena and advising 6 administrations for the last, I've been doing this for the last 5 decades in public service. I have never, ever, either indirectly or directly endorsed a political candidate. And the way that ad went, where they quoted me at the end, it was certainly in the context that looked very much like a political endorsement. And I've assiduously avoided that for so many years, like decades. And that's the reason why I was concerned about that, because I want to stay completely apolitical and stay as a scientist, a physician, and a public health person. At the end of that clip, they made a statement about it could not have done anything more. We were talking about the task force team that in the beginning, way back when things were really on fire, we were working 24 hours a day, day and night. And in that context, I said, I don't think we could have possibly done anything more. But let
me just ask you one follow-up to that, as long as we're talking about political campaigns. Senator Harris last week during her debate with Vice President Pence said, and they knew what was happening and they didn't tell you. Can you imagine if you knew on January 28 as opposed to March 13 what they knew, what you might have done to prepare? They knew and they covered it up. Was there a cover-up?
No, I don't know what she meant by they knew. I mean, we were talking about the risks. At that time, really early on, there was virtually no infections in the United States. And we were saying at that particular moment, there wasn't much to do, but be careful because things could change rapidly. I wouldn't think that. I mean, I don't see cover up there at all.
Dr. Fauci, I want to ask you very quickly about vaccines. The number of Americans who say they would get vaccinated has steadily declined since the start of the pandemic. And in our latest Yahoo News YouGov poll, only 38% of Americans say they will get vaccinated. How do you explain this? And how much of it do you think is because politics is undermining faith in our public health system and scientific consensus?
Dan, I think it's a combination of things, not one factor alone. I think there had been a baseline fundamental anti-vaccine feeling among certain members of our society. Then you have a situation where the speed with which we're doing things may be misinterpreted by some as thinking it's reckless speed and we're compromising safety and or scientific integrity. And that's just not the case. But then there's something else going on. This entire situation we're in right now with COVID-19 clearly is in the midst of a very divisive society that we see. We see that in the polarization of whether to wear a mask or not wear a mask. In a politically charged season of an election, all of that, people are suspicious that there's political considerations that are going into the development and the advertisement of going and getting vaccinated. So people hear mixed signals from authorities in Washington. That's always a bad thing because when the signals are mixed, it confuses people who are trying to figure out what to do. You put all of that together, and that's where you get, an unfortunate low percentage of people, relatively speaking, who are saying they're very willing to get a vaccine. What I hope happens, and I think it might, as we get a safe and effective vaccine, which I believe is going to occur towards the end of this year. I had predicted November or December, and people start getting vaccinated, and it's apparent to most of the people in the country that it is safe. There are not serious adverse events, and we're starting to see that it has an impact on the incidence of new infection, that more and more people will feel more comfortable and will get more and more people vaccinated. But right now, you're absolutely correct. There is that concern among a substantial proportion of people about getting vaccinated.
Dr. Fauci, one last quick question. There's two big events coming up for people in the next few weeks, Election Day and Thanksgiving. What advice do you have for people about whether it's safe to go to the polls? Will you be doing so yourself, or will you be voting by mail? And Thanksgiving, what advice do you have for people as to how they should plan their Thanksgiving?
If one does the polling process carefully and prudently, I think it would be fine for people to go to the polls who feel that that's something that they want to do. Some people are reluctant to do that because they don't want to go out, particularly vulnerable people. For those, mail-in ballots or drop it in a box ballot is I think would be fine. But
what are you going to do?
I'm going to try to get there physically, Mike. I'm going to try to get there physically, but my schedule is not my own. It's in flux. If I can't, I'm going to drop it in a box. I'm going to vote for sure, but I'm going to do one of the two, depending upon what's happening at the time. With regard to Thanksgiving, people have to make their individual choice, particularly who you have in your home. Are they vulnerable people? Are they elderly? Are they people with underlying conditions? I mean, it's such a beautiful tradition, Thanksgiving, of getting family together. I think we just need to realize that things might be different this year, particularly if you want to have people who are going to be flying in from a place that has a lot of infection. You're going to an airport that might be crowded. You're on a plane. And then to come in, unless you absolutely know that you're not infected, there are many people who are not going to want to take that risk. As I've said, and it's public because I've said it multiple times, I have 3 children that I would love to see over Thanksgiving. They're in 3 separate parts, triangulated throughout the country. They're adult women. I'd love to see them. They themselves are concerned about getting on a plane, being in an airport, coming in for a couple of days with their father, me, who is in an age group that is vulnerable. And they've made the decision that they're not going to do that. Hopefully by Christmas, that might be different. But right now, that was their decision. Each individual family needs to make the decision based upon the risk situation in your own family.
Well, Dr. Fauci, thank you so much for your time. We really appreciate it. Stay safe and healthy. And we look forward to talking to you again.
All right. Same here. Look forward to it. Thanks for having me on your show, guys.
Thank you, Dr. Fauci.
All right. Take care.